Well, the World Health Organization is sounding the alarm on the spread of a mosquito-borne virus, chikungunya, as cases climb into the thousands in China. More than 7,000 instances have been recorded in southern China after an outbreak late last month. It spread through the bite of an infected mosquito. The virus causes fever and joint pain, but is not usually deadly. Australia currently has no travel warnings or notices related to the virus in place. The World Health Organization is calling for urgent action to prevent its spread. Well, Jacqueline Stephens is an epidemiologist and associate professor in public health at Flinders University, and she joins me now from our Adelaide studio for more on this. Good morning. Thank you so much for your time. We sort of just heard about it a little bit there, but briefly, can you take me through exactly what chikungunya virus is?
Hi, thanks for having me. Yeah, chikungunya virus is a mosquito-borne virus. It's spread through the bite of mosquitoes, and we see it predominantly in the tropics. It's caused really by two particular mosquitoes. They're called Aedes aegypti and Aedes albopictus.
And what are the symptoms that people start to feel when they've been infected?
Yeah, so the infection is caused by, as I said, a virus, and it has a very quick incubation period and causes the symptoms of fever, pain and joint pains, mostly in our sort of extremities, in our fingers, arms, wrists, ankles. And we feel quite unwell. It's, as you said before, it's fairly mild for most people, but it can be more severe and it can cause long-term joint pain for some people.
You said this is a virus found predominantly sort of in the tropics. Whereabouts is it spreading at the moment, and is there a risk that we will see it here in Australia?
Yeah, so across the whole world there is over 3,500 different types of mosquitoes, but there's two in particular that we see in the tropic areas. As I said, they're both Aedes mosquitoes, and they're found throughout the tropical regions across all of those continents that are there, so through Africa, the Asian and Southeast Asian, and also in Central America. And we've known about this particular virus since the 1950s, and we've had outbreaks over time, particularly as those mosquitoes have moved throughout those regions and have adapted to new areas. And we do have some of these mosquitoes seen in our Far North Queensland and the Torres Strait Islands. So there is potential for the virus to infect the mosquitoes that we have in those areas. We do have these particular Aedes mosquitoes now living in those areas. And so there is a potential for it at some point in the future to infiltrate those mosquito populations and become endemic here in Australia.
So if people are travelling to areas where chikungunya virus is found, what can they do to try to avoid it?
Yeah, it's really important at the moment for people travelling to areas where chikungunya is being seen in higher rates to make sure they take precautions. So they're recommended to wear long sleeves and long pants and to use insect repellents, keeping their hotel room doors and windows closed, using fly screens or mosquito nets to try and make sure that they're keeping away from mosquito bites as much as they can.